everybody able to see my screen? Look good. Okay, so like I said, this month's topic is telehealth. That'll let us move on. And I just wanted to kind of put a little disclosure in. This article was published in 2018, so many of you are aware that a lot of the legislative things that were mentioned in the article have changed and updated since then. So just something to keep in mind as we're working through it. Trying to keep track. Okay, so if I move my screen around, I can read this to you guys. So AOTA defined telehealth as the application of evaluation, consultative. Sorry, you guys are jumping all around. My screen's going crazy. Preventative and therapeutic service delivered through information and communication technology. So I just want to start, the article mentioned several evaluations that they had looked into that could be utilized via telehealth. Is anybody using these? Had any thoughts when you read through these? I know I got like MOCA was one of them that was mentioned, and I got an email because I guess I had signed up for something at some point, and they were saying like suggested using like the blind MOCA to be able to use it via telehealth. Anybody else had any experience with evaluations or other assessments you've been using, or kind of how your evaluations are going?
Surprised to see that the MOHO wasn't on here.
Yeah, I was too. Yeah, and there's definitely a lot more, you know, that can be utilized that maybe they just haven't studied yet or looked at least in this article.
There I am. Hi.
Hi. All right, and then some of them I was surprised. Oops, I'll go back. Some of them I was surprised by was the like diameter and pinch gauge, because I didn't actually go back and pull up these studies, but you would have to like send the equipment to someone prior, and that doesn't seem like something that's very realistic in measuring.
Does anyone use the Coleman evaluation of living skills? I worked with her in Seattle when she was putting that tool together. It's a good one for both psych and home care. She went on to live in Canada, but she went to Seattle for graduate school.
Oh, cool.
It's you know, she's kept it up over the years and, you know, brought it more relevant, and it's just a really nice tool.
Yeah, I definitely think that's something that can be utilized. I'm trying to remember all of it that you use, but something that could be utilized for telehealth and in that sort of setting.
Yeah, and you could do it anyway.
A lot of these are something you would have to have, you know, a family member or caregiver or something that you're training on how to administer these assessments. Have you guys had any experience, or positive or negative, with trying to give either assessments or just a general evaluation?
Well, I don't work now in the area, but the mini mental status is kind of been around forever, gold leaf, easy and quick way of assessing cognitive, and you can do it over time.
Yeah.
You know, so it's just a straight, you know, tell me the president, who was the one before him, you know, straight question answer kind of thing. And yet it's, you know, it's maintained. It's a very viable tool, and it's easy and it's quick, and you can use it in telehealth.
Yeah, and I'll put that disclosure out there as well. I work in inpatient care, and so I am not working in telehealth. So I am, you know, trying to pull some of these things together. If there's something in the chat. In pediatrics, Darlene says they've used the PD via telehealth. Anybody else having good experience with that?
What PD doesn't, I'm in pediatrics. Which one are we talking about? The PD is what? Which one? Useful information.
I'm not sure. That's a PEDI.
Mhm.
I'm not familiar with that assessment, so I'm not sure.
Yeah. I'll put it down.
Hello, my name's Donna. I work in low vision, so we have very specific evaluations. I worked with our OD yesterday on doing an evaluation, and I wasn't doing the evaluation. She was doing the evaluation, but she wanted me to sit in on it. She had to send some eye charts to the person. They had to print them out, and then we had to work through appropriate lighting and appropriate distance and all this stuff for, trying to do an eye exam from afar. So
Yeah.
it was really interesting. And the one thing that we have something called the MN Read. I'm not sure if anybody here does anything with vision, but it has, I have an app for the MN Read on my iPad. And so I kind of worked it out so that I could do a screen share with that and have the patient in the app, and it would, configure all the outcomes. So that was a good thing. Other than that, we have a specific evaluation that we can use, and I can do some observations with it, but I'm in the same boat everybody else is. It's like, I'm not sure. Some things we're going to have to send to them if they don't have access to it. So I'm not sure how that's going to go.
Yeah, and that's an interesting thing to think about too, is, coaching them through some of these things that they, what was a real simple, quick eye exam, even just for acuity, is now, takes a lot longer to get through, to have just working on the setup that you may have already had set up at the clinic and ready to go.
I think, unfortunately, for at least I'm not out seeing patients right now, but more of the home health folks are struggling with PDGM and just getting visits, period. And we don't have really any platform to actually realistically execute telehealth. So it's more of a, right now, trying to figure out what that actually looks like, because we also have to use our EMR system. So figuring out all of those hoops amongst all of the other issues that we're facing with furloughs and being laid off and things like that because of PDGM.
Yeah, no, that's a great kind of segue into our next topic. I just broke up the examples from the article, and my kind of takeaway from that was that these are like the ideal scenario of what they put in, and maybe not as realistic as what I'm hearing from other clinicians of what's really going on. Is anyone else working in home health that's kind of experiencing those similar barriers that Becky was mentioning? You're definitely not the only one. I've heard that from other people trying to, problem solve. Some
Yeah,
of those.
I mean, I've volunteered to be on the telehealth team to set it up, and they were just like, okay, that's great. But I mean, we just all took a massive pay cut. So, and a lot of people are getting laid off because the visits are not happening for all sorts of reasons. And people are now being discharged with positive COVID-19, and they're not telling people, and they don't have equipment. So it's like, I think is a lot of clinicians are just like really in the fighting mode at this point. So like, unfortunately, they can't even think about telehealth because they're just trying to get 10 visits in a week.
Wow. Yeah. Jeez.
I'm having a bit of a different change from normal, but Also home health, but we're doing second visits or checkup visits the next day with our patients, as you know, using the telehealth system. So especially the nurses when they are, watching a patient, but ours who are coming out of hospital have all been tested, and only if they're negative are they released. So we're having just a bit of a different, I guess, outlook in our region or our county about how that's progressing forward. That doesn't mean that it isn't in the homes when we go in that haven't been tested. So
Right, or even family members or other people in the home.
that's it. It's a different slant, but certainly nobody's getting let out of a hospital here that is tested positive until they, and it's not read on the documentation that they have been tested and they are negative now and are coming, live in an area where it was really based on, at least the company I work with, is surgery. So we were, hips and knees and shoulders and hands and all kinds of surgical interventions. We had the contract with all of the surgeons. So that has gone down to a minimum, but it doesn't mean people aren't still falling or having things happen at home. So that's been our kind of take on it. But yeah, but it's different. But we are doing that second visit, doing a use Cincy. And we set that phone up the time when we first go in, and it seems to be working.
I mean, even, we're kind of derailing a bit, but even on the inpatient side, we're seeing in acute care a drastic decrease in the need, just because elective surgeries have gone down, and also the hospital was low census for a while. All right, I saw one question come up about, is anyone billing for and getting paid for regular insurances? Anybody from a telehealth perspective can talk about that some?
Well, no one's in trouble.
Are we getting paid? The big question out there. Okay, so yes, billing and getting paid with lots of work from Darlene. So that's good. And then Donna asked what insurance is. And you guys can keep on the track. So another thing that was mentioned in the article was like ergonomic assessments, that those are something that could be done via telehealth, having people send in pictures of their setup. Maybe it's their work desk or at home. A lot of people are working from home, so their work desk might be different. Is anybody in that area of practice or had any experience with that or comments on that? I definitely think it's a great, area of practice that could be done via telehealth, because there's a lot of education-based things you can recommend. And this is a seating clinic question about, or scenario about bringing in other clinicians as well. So I don't know if anybody is in seating or can comment on that, or working with other practitioners and at the same time.
That there's a lot of movement toward this in where I am at Shepherd. I know Jackie's from Shepherd too. The CRT group, Complex Rehab Technology Group, has been really forward about making sure they have their codes, and they host almost weekly webinars. They had their second one today, and they have all the codes that they've requested, with the exception of mobility training. So once they get the complex rehab technology, being able to actually train someone remotely is the code that they're working on. So it sounds like that's going really well. It sounds like the majority of the challenges that OTs are having is that we don't have the capacity to practice across state lines. You have to be licensed in the state, or as it referenced in the article, you have to be a teleconsultant. And then what does that look like for getting paid? So as far as I know, we haven't gone that route, but it's interesting to know that that's a struggle across the US for OTs since we don't have PACT or any type of licensure agreements. I meant to look up the states today, but I didn't get a chance to do it by state because I guess by state they can approve people from out of state. I don't know if anyone's aware of states that have moved in that direction.
Any experiences?
Sorry, I was on the big AOTA and there's a whole 2 pages or 3 pages of state by state latest ones that are allowing across the boards, but you have to look it up by state, but it's a huge chart.
Okay.
Can you share the
That's good to know.
hyperlink for the people that are it must be in front of the firewall, right, for membership? Could you share the URL?
You have to be AOTA member. For OT, you should be anyway, but nonetheless,
Yeah,
it's
if you can
inside
share that
the,
link, because then you have
the
to.
latest.
Oh yeah, AOTA made the majority of anything related to COVID in front of their membership wall in an attempt to, increase access for everyone. But I agree, definitely.
And then those, for that question earlier, those insurances are listed in the chat if anybody wants to look back at that.
The state, did somebody post it in the chat box? The state one is free. You don't have to log in for that one. I think they're considering it part of the COVID. Do you need
Okay. Yeah, if you have that link, you can post it. If not, that's something I can add later either way. But yeah, if you have it, great. That would be very helpful.
Sure.
All right, so this is more of an outpatient question. So anybody working in outpatient had good experiences or thoughts on the article related to their treatment? And I think outpatient has some of the same barriers with the state lines and that kind of thing too with seating clinic.
Yeah. Many of them.
Sorry, my dog was barking when I was about to say something.
That's okay. I was gonna do a little extra time there.
I don't know, is Stan on this call actually? I don't think he is, but
I don't think I saw Stan's name come up when I was accepting.
anyway, because a lot of this, even though it's like outpatient based, a lot of it is very, the client has a lot of mental health needs.
Right. Yeah.
And I'm going to talk to Stan momentarily after this call gets done about some of those issues in telehealth and mental health, particularly, and especially with PT trying to kind of encroach on a lot of that, and like, not to get overly like political or anything else like that, but we're not doing a real great job. We're kind of ending up taking a back seat to something like an area, particularly with mental health and things like that, in an area that's like our bread and butter. So anyway, I just didn't know if he was on the call or if he could speak more to that, but stay tuned.
Yeah, so any outpatient mental health kind of experience with it. I know I was talking to a friend who works in pediatrics, and she was telling me some of her parents have like voiced not necessarily complaints, but like that they're feeling very overwhelmed by telehealth because a lot of these kids, had multiple disciplines, and now they're doing PT and OT and speech and ABA and whatever else all via telehealth, and that, before sometimes their therapy time was a break for the parent to sit in quiet in their car or whatever they needed, tend to another child or return a phone call or whatever else. And now that whole time is being, blocked out, that they're doing telehealth. So I didn't know if anyone else was having similar experiences with caregivers or just feeling overwhelmed by a lot of it, or yourself being overwhelmed by all of the new changes. Everybody's doing great. Yay. All right, I think we have, and this is a school system example. I know last telehealth kind of conversation we had with like GOTA, there was a lot of back and forth on what people were doing in the school systems. Was telehealth working? Were they using other platforms? I don't know if anybody's in the schools and they can kind of talk through some of that. All right, I thought this example was a good, they kind of combined, in a lot of these examples, they combined telehealth with clinic stuff, which was like, okay, this was ideal scenario in 2018. There were things you could use it for, and that's where I thought it was more eye-opening. But, that's not our reality right now. We're having to do everything. Okay, so this is another outpatient example, working more on range of motion and exercise programs and that sort of thing via telehealth and teaching those protocols. All right, so I just wanted to kind of see how, if you are practicing telehealth or just with all the COVID updates going on, what barriers, this is just kind of a time for us to chat and use the telehealth article to kind of guide us of what research is out there, but and to see what barriers you guys are having or like how we can help each other problem solve some issues.
How do I turn in?
Darlene said she works in a multidisciplinary practice and she's hearing from parents that they're also very well overwhelmed. We recommend not having back-to-back sessions as it is too much screen time and hard for the caregivers to find time. Also, my OTs are helping with sensory diets that also help with the environment at home for work and school and life at home. That's a good suggestion of breaking up the schedule.
Yeah.
I do have I don't know, question or pick all these OT's brains here. So if we were to say do research in telehealth, I'm a PhD student at Georgia State right now in biomechanics, and our lab is closed. So I'm been brainstorming different interventions and can we apply this to some of our populations, and how could we use that opportunity in terms of research to get on the front end of this. And primarily I work with the older adult population, so whether it be a communal living situation, if there was some sort of OT sort of public health promotion in terms of toileting hygiene to reduce infection control, all of those things, not so much on the side of the professional, like the caregiver, but there's sadly a very it gets very neglected to have the person themselves that might be living in a memory care unit, for example, for them to wash their hands or have that assistance to wash their hands after they're toileting. Does that make sense?
Yeah.
Oh yeah, no.
So what, do you guys have any thoughts on that, any experience, or any other types of movement interventions or something like that that could be used in a telehealth platform, like boxing type programs, adapted boxing programs for Parkinson's? If these types of groups were provided with like a tablet or some way to receive the telehealth or the visits, what types of assessments could be used, or that kind of thing, or anything else, any of that.
That was about 7 questions.
I know.
Anybody got
I
any
think the
thoughts?
most challenging thing that I'm having trouble with, even with Sensi, is that it's all geriatric population here, and they either can't hear it because the phones don't go loud enough and their hearing aids don't work well with them, or they can't actually get on the program easily, even if they have a smartphone. So again, that would be a nice area if there was some way to just show them some basics or something on getting up into telehealth versus all of the millions of things that they have, chair exercises.
Just like technology access.
Because that's the struggle. Once you,
Getting them on.
yeah, because once we leave their home, the next day they have trouble trying to get up, right? Again, even though we've gone over it maybe once or twice and I've drawn up things and it's a one button push, sometimes that's tough, because we've only done it once or twice with them. And they don't get much, there's nobody going slow enough with them enough times. By the time I discharge them, they're pretty darn good. Sometimes that's mostly what I'm doing with them, is teaching them something about accessing emergency services on their phone. But there isn't a whole lot of information for them about that, or any place for them to get to that they can watch it again and again.
I also feel like
everybody moves too fast.
I also feel like as
Ben, did you have something?
Yeah, just I know that a lot of physician practices use the role of an initiator to call the patient like 15 minutes before the session starts, ensure that they have good connection, double check that they understand how to use the platform, and then they put them in a waiting room before they connect the physician, who then they check that they can actually access things and all the same things, and that person then merges them and then moves on to the next practice area. Like, it's somebody basically prepping a room for them. It's virtual. And I think as resources are sparse, it's hard for therapists to have that type of person working with them, or because we're launching this for the first time, we haven't had a chance to actually get that type of support.
Kristen, do you guys have any direct role, or OTs have a direct role in that setup phase, like a teaching, because like the article mentioned that it's also our role and within our scope of practice in terms of all of those aspects that you just mentioned, in terms of accessibility and making sure those things are set up. Are any OTs working in that space specifically with that setup?
For our practice, they are. I just mean generically, I think that's going to be I think that's probably a challenge for a lot of people.
There was also another general question on the chat. Do our assessments have validity because they weren't normed through telehealth?
I think
Anybody's
it's like any other
thoughts?
time you adapt it. I mean, anytime you deviate from what the standardization is, you have to comment on that, just like it says in the article. So it probably depends on which assessments you're completing. Looking at the time Get Up and Go test, I was thinking that too. I'm like, how comfortable would you really be having somebody do that if you know they have a recent fall history and depending on what the diagnosis is?
Right. Yeah, I definitely think it's something you have to comment on. There are some that we could still gain, valuable information from. But that's not how the test was designed to be administered. And I mean, just thinking about giving assessments with family in the room, especially like a cognitive assessment, and they're jumping in like, come on, you know the date, it's my birthday month. Like, and they like are totally veering from the script of what you're supposed to actually say. Any other issues? Telehealth, I'll just give you guys a warning. We have right at 5 minutes left. So.
I thought it was neat to learn that the comment that was made on, I don't know how many pages this is, but it talks about how the license portability for anyone that's a veteran, that situation is different for them. And it cited the 2008 articles that indicate that veterans can receive services from people regardless of what state they're licensed in.
Wow.
Yeah, that was interesting to learn too. Yeah, any other comments about the article too you guys had?
Other than it's good timing, because I'm trying to pitch and brainstorm to my advisor for all sorts of projects that can, that the research will be able to be fluid within this telehealth space to another type of platform.
Yeah, and Rebecca, I know you put your email in there for to get the continuing ed certificate, but go ahead and put your email in the chat again. That way people have it. If they have some idea that comes to them tomorrow or something, they could shoot you an email about something that would be appropriate for research. Donna said, I'm concerned about functional mobility tests with low vision patients, safety falls, and needing family assist, which is very true. All right. Anybody else? Awesome comments. Well, thank you guys for all
Chelsea?
participating. Yeah, go ahead.
Just one quick question. It's not about practice, but it's about consent forms. Is anybody having any difficulty getting consent forms signed before you do the telehealth?
Verbal consent is now allowed. We haven't gotten that far at my place of employment to know if I can comment on that, but just that I know that they waived a lot of normal regulations for it.
And my place wants to get signed consent forms. And some of I work with people with developmental disabilities and intellectual disabilities. So I have to get their legal guardian to sign it. They don't always live in the same location. Sometimes they live out of state even.
Oh, God.
I do know, like the Doxy Me, whatever it is. They send you an email, and then like within that email, before your visit or whatever, there's a consent signature pages there.
Okay, thank you.
And then on the chat, we have tried to send out consents in schools, but now they're just using verbal consents because they weren't coming back.
Yeah, and I know that, but I know that eventually they're going to go back to having signed. That's just for this COVID time, right? That they waived that.
That's my understanding, yeah.
Okay.
I wonder if people have done the printing out the page, taking a photo of the signed document.
And that's what Darlene was saying. Email the consent, have them email it or photo it back because the HIPAA regulations have been lifted.
That is.
And if they send it back, you have that digital time, you know, in other words, it's already electronic. So they don't have to mail it or anything.
No.
Exactly. So we have less than a minute. I just want to go over real quick, hopefully we have time, how the continuing ed works. So for MVCOT, it's like half of a continuing ed. That's like a PDU. So you'll get that for attending tonight, and then there's a form to fill out. So I will send that, just how it relates to your practice area and what's going on. And that's just for license renewal. So I will be sending those out to you guys. But thank you guys so much for participating.